All right, so we're doing a little welcoming the knee back into the family series of exercises. So if you want, you can start and do like a little nervous system test and see like, what does your rotation feel like? What is your forward bend like? Is there something in your body that may be limited? Or like the knee may be interrupting that forward bend and the lengthening of your hamstring. So that's a good baseline. And then what we started with was just massage, right? So you're just spending like a minute going around mobilizing your tissue and talking to the skin and the fascia and the joints and the muscles and waking them up, right? So that your brain has a good picture of your body part. And then we did some just kind of gentle range of motion. So you can bend the knee and do a circle. And then notice, is there anywhere where maybe it's clunky or it doesn't move smoothly? And so just like 10 or 20 in each direction at different speeds. You can go super slow, right? Or you can go fast and make sure it's smooth. We did that. And then we did some closed chain knee circles. So you're keeping the hips level and the foot is flat and you're just trying to isolate the knee. 5 or 10 circles clockwise and counterclockwise. And then we did a little side lunge, just changing the position. And again, these ones are good to go slow. And if you wanted, if you have a band, you could anchor it somewhere, right? Maybe it's anchored over here and you're doing 10 circles with the anchor to your right, maybe 10 circles with the anchor to the left, maybe 10 circles with the anchor to the front, 10 circles with the anchor to the back, right? Making sure you can move smoothly and control through those ranges of motion. Then we did a CAR, controlled articular rotational stability. So here we're working on the rotation of the tibia and the flexion and extension of the knee. So I'm going to internally rotate all the way. I'm going to sit up tall. I'm going to squeeze all the muscles in my lower leg, and I'm going to straighten it, and then externally rotate and bring it back. And I'm going slow, and I'm just squeezing the hell out of every muscle down there. 5 or 10 of those. And then we did banded tibial rotation. So you can imagine a band over here and put your hand on your tibia to make sure that the tibia is actually rotating, because I can move my foot and not have the tibia move, but here my tibia is rotating. And what you really want to work on is, yeah, pulling is good, but really it's the slow, controlled release, which is the most integrating movement, right? And then you can do it over here. May not be quite enough tension. 10 or 20 of those. Then we did some hamstring isometrics. So first, lay on your back, dig your heels in, lift your butt up, and just dig and engage your hamstrings. And if you want, you could practice marching, keeping your hands on your pelvis, making sure your pelvis isn't rotating, right? Then we used our gliders. Start in a glute bridge, pop up, and then do a slow eccentric lengthening. When that becomes easy, try single leg. If that becomes easy, do it banded, right? So there's an anchor over there. Anchor is pulling my leg away, and I'm doing the same thing, lengthening it with the band. You can also use a foam roller. This is a little easier. Coming up, doing a slow hamstring lengthen. You can do that on a foam roller. You can even do it on a Swiss ball, which will be more unstable. And yeah, and then retest your range of motion, your forward bend, and thank your knee for all its hard work.
Okay.